on transformation and innovation, driving the online healthcare ecosystem and reshaping health infrastructure. Joining us for this discussion, we have Dr. Raja Datta, Director, Avisa Smart Hospital. May I request Dr. Raja Datta to please join us on stage. Thank you. Thank you so much, sir, for joining us. Dr. Shailesh Jawar, Director, Apex Hospitals Critical Care Hope. Welcome, Dr. Jawar. Thank you so much for joining us. May I request Mr. Varun Kansal, Medi Assist Healthcare Service Limited, to please join us on stage. May we have a round of applause for Mr. Varun Kansal, please. And requesting Dr. D.K. Gupta, Chairman, Felix Hospital, to please join us on stage as he is the moderator for this discussion. Requesting Dr. D.K. Gupta, Chairman, Felix Hospitals, to please join us on stage. Thank you, Dr. D.K. Gupta. Over to you to take the discussions forward on transformation and innovation driving the online healthcare ecosystem and reshaping health infrastructure.
Hello. Good morning, everyone. This is a second session, I think, on digital transformation and similar topic. Topic is transformation and innovation driving the online healthcare ecosystem and reshaping healthcare infrastructure. I will be moderating the session. I am Dr. D.K. Gupta, Chairman, Felix Hospital, Noida. With me is Mr. Varun Kansal. He is from Medi Assist Healthcare Services Limited. Dr. Shailesh Jawar, Director, Apex Hospitals, Critical Care Hope, and Dr. Raja Datta, Director, Avisa Smart Hospital. Thank you so much. I will start from Dr. Raja Datta. We talk about the online innovation and online transformation, digital transformation. My first question is to, if we talk about this hospital, hospital footfall and hospital system process development based on digital transformation, so what will be the role of online transformation or digital transformation on reducing physical footfall in hospitals? How it will impact the financial growth of hospital? How it will benefit the patients of the hospital?
Thank you, Dr. D.K. Gupta, and thank you, the organizer, for this event and inviting me for this session. I am Dr. Raja Datta, Director of Avisa Smart Hospital. This is a concept which is bringing transformation in the digital space in the healthcare area. When we talk about digital healthcare, we talk about a lot of softwares, lot of apps, lot of digital technology in place. But we don't take care about, talk about the patients who are at the hallmark of this complete ecosystem. Rightly said that we need to introduce some kind of digital interface wherein the number of patients, as we have seen during the COVID time, and thanks for the previous session also, which were when Dr. D.K. Gupta was moderating, that there was a lack of patient. Patient is not looked after well in the whole journey. The doctor is, well, he is equipped with digitalization of the hospital, the digitalization of the process, and the hospital as well. But who will take care about the patient? We, as an organization, Avisa Smart Hospital, focused on the pain points of the patients and seen that patients needs to be looked after, not only at hospital, but also at home. So when we talk about patients' pain points, patients do require healthcare at home as well as healthcare at hospital. So So whatever is required in the hospital, in terms of services, from starting from hospital registration, appointments, and services, admission, discharges, treatments, insurance, everything should be available on the patient's smartphone. We could make it available to them, including the AI and blockchain and the machine tool available to support the patients. Because at the end of the day, patient needs to decide for his own treatment. As we have seen, as of now till date, the doctor and the hospital keeps on deciding the patient's fate and his treatment. The patient's say in the process of decision making is very little. But if you give the patients empowerment about the information available in the whole world, the medical science, the decision support system, which will make the patient to decide which doctor, which specialty, at what rate, what budget, at what category he can choose in hospital. So he will choose only the hospital whenever it's required to be chosen, if it is critical or it is not critical. So AI will decide at the back end of this platform whether to visit a hospital or to not to visit. In COVID, we have seen unnecessarily we have crowded the hospital wherever the patient were required to be taken treatment or not to be taken treatment. But this platform which we are providing at the hospital, Avisa Smart Hospital, we are trying to reduce the inpatient, but at the same time we are increasing the efficiency of the hospital. We are bringing the hospital to the patients, to the patient house. We are taking use of the patient's house bed as an hospital bed wherein he can take care about himself if it is not very much important to get admitted in the hospital. In the bargain, the hospital gets revenue out of it even if the hospital patient bed is not filled up. So the efficiency in terms of revenue, efficiency in terms of servicing the hospital patients, those who are critically ill, and your critical beds are utilized at the point of service when the patient is required to be admitted. We have seen in the hospital, at the registration desk, or the admission desk, or in the laboratory or pharmacy, or at the imaging line or ER, there are a lot of waiting time. So these waiting times can also be reduced by simply providing an AI interface which will coordinate between the hospital and the patient. This way we can reduce the hospital footfall as well as increase the efficiency of the hospital.
Thank you so much, Dr. Ajay. And definitely we agree with you that definitely we do the online this online ecosystem. Definitely footfall will be reduced to the hospital, and for hospital it will be a win-win situation for both the hospital and the patient. Patient will have accessibility through a healthcare system at their convenience, and their experience will be improved definitely. It will be affordable also for them. And for hospital, like they have to build only the beds for critical care, for surgical beds, or for the quaternary care. They do not need to build OPD department, or maybe they don't need like beds for like preventive or secondary care, or like even primary health care services. That definitely the capex will be reduced for hospitals, or even OPEX will be reduced. Affordability for the patient will improve. Thank you so much. And now my next question is to Mr. Barun Kansal. He is from Mediasis TPA. And my question is to you that in looking into the current scenario, what is the scope of the online ecosystem for the future? What is the vision of the digitalization in the healthcare system? And how the insurance industry will going to respond?
So, thank you, Dr. Gupta. Good morning, everybody. So, I think, first of all, I would not like to put any boundaries in terms of innovation. This is only the scope where we can do innovation. If we think very differently, there are enough opportunities in healthcare. Currently, we have just scratched a surface. If we have to move this elephant, we have to really think differently how we can innovate. And there are a lot of innovation has already happened in healthcare in terms of discoverability of the healthcare providers or logistics, convenience. I think next set of innovation will happen in affordability, accessibility, and predictability of the healthcare. If I talk about especially our MediAssist, what we are doing there, as my colleague Himanshu said yesterday, we are trying to convert more of the tribal knowledge, which is being held by certain set of people in healthcare, into a machine, a AI driving, helping people to choose a right healthcare provider. And at a MediAssist, we are very focused on delivering a financial outcome for an end consumer. I think going forward, to make healthcare affordable, we have to help consumer to find a right provider which fits into their budget. A budget can be their insurance policy, or if they are from a cash, how we can navigate people better to find a right bed, a right hospital where they can get a quality healthcare and within their own budget without breaking their bank. 7% of the families in India go to bankruptcy because of the medical expenses, right? And overall, then we have to also think about patient experience, how the patient experience is in terms of simplifying an admission process, which drives the operational efficiency in the hospital, why a consumer end up going to a hospital to get an admission or get in a bed. Why can't be done sitting at a home, right? This can be driven by a simple cloud-based technologies. Then you see a lot of problem at time of discharge. Once the doctor says discharge, a patient ends up waiting for 4 to 6 hours, which basically also impacts the operational efficiency of a hospital, right? How we can enable a quick discharge. So at MediAssist, we are currently working with a set of hospitals where we are enabling a quick discharge. We are helping people to get out of the hospital once doctor says discharge without even waiting for a discharge summary or a bill to be prepared. I think enough data exists, enough technology exists to say what kind of bill we are looking at, what kind of care or cost we are looking at, and what kind of care protocols we are looking at, and enable that instant discharge for a user. And I think this ecosystem will develop. The innovation will be more fruitful if the entire ecosystem integrates with each other. As a MediAssist, we are open to work with different players to enable affordability, to enable predictability, to enable accessibility to healthcare. And I think that's where the real innovation lies. But my only request is, let's not try to think within the boundaries we have, whether it's HIS, whether it's LIS. Right now, we should go beyond it. There are enough opportunities, enough data in this country which exists with ABDM in place. I think a lot of data is there which can be utilized to predict what kind of care protocol has to be followed, what kind of care of cost we are looking at. And from an insurance perspective, I think now insurance companies are participating in the care journeys. They want their members to have an excellent care experience, quality health care. As our CEO, Mr. Satish said, right, they want to participate into that journey and make sure that members are taken care of. It's not about sick care anymore. It's more about prevention, predictability, how we can enable it. I think a lot of innovation will happen, and insurance are coming up with a lot of different products. I think hospitals should involved into this, providers should get involved into this process where they enable insurance companies to build better product. At MediAssist, we are open, we have built a platform for this kind of innovation where we are working with different providers, insurtech players, distributors, to help them enable a digital distribution, help them create better products, enable member experience where people feel like any other experience, right? Today you book Ola, you buy groceries, everything is delivered quickly, instantaneously is available. How can we do that in healthcare? So at MediAssist, we had taken that first step and we are solving it. It's just more about providers working together, building an ecosystem which drives the member experience.
Thank you so much. You are correctly that turnaround time in any process, it being a discharge process or any other process, and discharge is one of the critical process in the for the healthcare provider and for the patients also. If it can be reduced, it will be a great thing for the healthcare providers to improve their operational efficiency and to improve the patient experience. Thank you so much.
Just to add on, it's not if for us, we are doing it.
Great. I mean, we are watching it, but this is one of the pain area for healthcare providers, like discharge be at advised discharge in morning at 9 a.m. at our first round from our clinician, and by the evening the room is not vacated and there are so many queries, there are so many replies are sent for the around 30 to 40% people. And the experience what we have provided in last couple of days or last 3 during the stay of patient in the hospital, that demolishes or that reduce to a critical level at the time of discharge. That is one of the our pain areas. I am telling you that I think most of the people here they are sitting, they will be agree. So I think this process, that is a crucial process for us also and for you also, and we will work together definitely. And I am with you that I think provider and the healthcare insurance player, they both work together to improve this process and to improve the patient experience. Thank you so much. My next question is to Dr. Elets. The question is same on the online system, online ecosystem, that does your online ecosystem or digital platform is fully integrated with your HIS or EHR? If not, then what are the challenges? If yes, then still there are challenges or not?
So thank you, Dr. Gupta, for asking that question. Good morning, good afternoon to all of you. I think the most important aspect of, I will answer your question in 2 or 3 parts. From a clinician's point of view, because I'm a critical care clinician, I also wear a management hat. And I am probably a technology, I would not say enthusiast, but I probably am finding adversity, not finding ways that we can prevent when people have adverse to adopting technology. So from a clinician's point of view, I think all of you have said, turnaround times and patients and, patient satisfaction, and we've been talking about that. I think what we have to also remember is we have a very unique challenge in India. We are a huge volume country, and we cannot deny that fact that we have to deal with volumes of patients. I don't think so any other health infrastructure in the world probably deals with that kind of volume. And with volume, what is the beauty is that now we are talking about value also. So that amalgamation of volume and value and preservation of value when you are delivering care is something that I think probably this whole conference is talking about. Now, the second aspect from the management or the clinician point of view is, and I think Varun has also mentioned that, is the ecosystem word. I think in the previous talk also, we talked about ecosystem. I think what is very good to see is within their own silos. So he represents insurance and Sir represents a smart hospital. And I am a critical care physician. Within our own silos, we are all working towards improving or delivering that transformation. But what is good now is, and what should happen, and what is the biggest challenge is integration of all these silos. And that is where the challenge is. I think technology is never the problem. Technology is available, it is getting affordable, but the challenge is how people are integrating, adapting, and how the integration is happening with technology. So we started, I will tell you about my experience. So we started this initiative called HOPES initiative, which was Health Outcomes Prevention Evaluation Systems, which was our in-house system, because our 40% of our beds are critical care beds. And always it's the most capex heavy bed. It is where the most revenue occurs. It is where the most complications or mortality and morbidity happens. And by implementation of data, by integrating the clinicians, the management, showing the capex benefit, reducing mortality, addressing the need of all the stakeholders, from the patient's point of view, from the clinician's point of view, from the staff's point of view, from the management point of view, from the IT point of view, we've been able to integrate in the last 3-4 years EHR for our critical care needs. Yes, we've not been able to diversify into the non-critical areas, but I'm very happy that I think resource utilization, one critical care bed is now monitored 24/7, not only by physicians who are present on the ground, but also by critical care experts. We can audit, we can improvise, we can reduce turnaround times, we can check antibiotics. So now I feel why integration is happening, value is coming out, we are able to address the volume, the EHR integrations will become the future of healthcare.
Thank you so much. Thank you. Now my next question is with Dr. Rajadatta. If we talk about the smart hospitals or smart healthcare services, then what is the role of AI, artificial intelligence, in building smart hospitals and how it could impact the patient care?
Thank you, Dr. DK, sir. Definitely, when we talk about AI in hospital, we do know that hospital operations is a complex process, starting from admission to discharge, or starting from registration to serving the patient by giving the treatment or selling or the laboratory test or the pharmacies. We do many similar activities in the hospital. We do many errors in the hospital industry. So AI for that matter, or blockchain for that matter, club this all similarly doing processes which are correct in the organization. It depends from organization to organization. So we have grouped all these similarly doing correct processes into one group and similarly doing errors into one group, which can bypass or forward to the next level, so that the human interference should not take place more than the technology or the machine takes time. Machine can itself define or decide which is the correct process, and it can go forward without approval or without stoppage or barrier. And if there is a mistake or an error in the system, it can go back to the previous step and gets corrected automatically, just like your laptop, go into automatic repairs mode and can help you out to come out with a fruitful outcome. In this manner, we have seen the patient's pain point. Just we are discussing about the discharge process. There is a platform which is integrated with our platform with many of the insurance companies, wherein the insurance discharges happens in auto mode. Only 1 to 2% discharges comes into the TPA desk, wherein there is a one document or a half a document requires to be added on. Rest, it is on all discharge trend, which is happening as per the disease based. The hospital concerned who is discharging such number of patients with such number of insurance companies, they have developed over the years a valuable trend, disease discharge diagnosis, and there is a hell lot of data which can detect the right discharge or right treatment methods or right treatment protocol. So I don't think so it is no more required so much of time. So AI is definitely working on reducing the patient operation time and the patient's waiting time in the hospital.
Great, thank you. One more question is that how AI will empower our clinicians or doctors from making provisional diagnosis, correct diagnosis, reducing errors, even providing suggestions on diagnostic tools. Even in diagnostics, if we talk about how they will ensure our radiologists or pathologists to make correct diagnosis or correct impressions on the radiology reports or lab reports.
Definitely, thank you, sir, for this beautiful question. This is need of the hour. Actually, in West, it is already in place. This is our second phase of platform, which is going to be added on very soon. That clinical decision support system, which is backed up with Harrison's and Davidson's and many other unique gold standard practice of our Indian medicine and practical medicines, wherein the patient-based, patient-oriented history, patient-oriented disease references are taken at the back end, wherein when the doctor or the patient keys in his complaints and uploads his images or laboratory test, including the prescription, previous, old or present prescriptions, they all being read by the AI in the software and throws suggestions to the decision support doctor to diagnose the closest 4 diagnoses out of the complete data bank and helps the doctor to make his decision precise. And if required, certain more tests can be suggested and more diagnoses can be looked into, which can be, as earlier session Dr. DK was saying, regarding rarest of the rare diseases, which should not be left out of the doctor's mind when he is sitting in the outpatient department. So these clinical decision support systems are coming in big way in India also, and it would require a lot of your cooperation as well as contribution, because it is India. We may not be able to copy all data bank of the West. So Indian data bank has to be built very big way.
Please.
So I think when you say, sir, AI, I think we have to all understand, I think over the years, this technology, the based words, AI, ML, they're huge. I think the scope is huge. I think what is more important, I personally feel, is that where you are going to make the most impact. What is the current priority right now? And what will, if you look at from the, maybe from the stakeholders' perspective or from the financial perspective, where you are, if you are going to make the most impact with the least amount of input, I think then the acceleration will itself start, and I think the whole ecosystem will be abuzz with the energy that creates that. So I think just by saying that, you know, we use very small modified early warning scoring system for admissions. And then we know that, you know, in that area, it's green, red, orange, kind of those kind of things. So staff allocation, equipment allocation, resources, formation of rapid access teams, everything then I think can be prioritized according to that by just a simple act of prioritizing the need. So I think that is where I find that prioritization and impact of your input, I think it is very important to calculate that also.
Thank you, Dr. Saab, for your contribution. My next question is to Mr. Barun Kansal. If we talk about the insurance perspective regarding the online transformation, online adoption, online digitalization, or there is a digital transformation in the healthcare industry. So what are the challenges for insurance players to provide great experience to healthcare providers and the patients, so that we should know and we should find out some solutions? And what is the future as a insurance care providers for healthcare, like deliverables or healthcare providers and the patients?
So I think they're not challenges per se, I will take it, right? There's enough ecosystem, there is enough data, right, to enable a patient experience. So I won't call them as challenges. These are certain ecosystem internal workings, how we all work together, right? So let me divide it into 2 parts, right? What we have done till today, I'll again take MediAssist example, what we have done and what we are looking to do. So if you look at in terms of MediAssist, we process 53% of the claims without even touching them. Nobody looks at it. As Satish mentioned in the morning, 90% of the claims, we didn't even ask for our documents. We just paid to the hospital based on a trust, based on a technology. Payment has been enabled, right? 81% of my cashless claims comes today online. 50% of my reimbursement claims comes today online, right? So it does not, insurance is not innovating, or they're not delivering an experience, right? At a discharge times, 78% of my claims get processed within 30 minutes.
Wonderful.
That's what we are talking today. If I'm talking about tomorrow, we want to make sure that, so there are challenges, right? A patient goes to a hospital, there is a lot of information which exists, but there is no decision-making framework for them how to make sure that they're going to the right hospital in terms of financial outcome. So suddenly they get surprised at time of discharge, this is the amount I have to pay. How do we build that certainty or a predictability for a patient so that the admission and the discharge outcome does not vary? for them. So we have built something called estimator or a navigator, which helps consumer basically upfront to find a hospital which is in their budget, if they have an insurance, what kind of out-of-pocket they are looking at. If they don't have a money to pay for an out-of-pocket, what kind of another financial resources can be made enabled to them, right from care now to pay later, or even crowdfunding or a different mechanism, right? Then we have also worked very extensively on, which is there in the market right now, basically call it as an e-cashless, in terms of simplification and admission and a pre-authorization process. You basically sit at home, fills a couple of details, then machine takes it over to process the claim, which makes it very quick. It's like booking an Ola cab. It's as simple as that, right? Then, as we spoke about discharge, we again right now have put up a technology in a couple of hospitals in Bangalore where we are testing it. Basically, once doctor says discharge, patient is just ready to walk out. There is no need eventually to wait. So I'm saying Wonderful. There is no 30-minute wait time even to process. It's just within a second, right? Then even in terms of availing a cashless, we have come up with the on-demand cashless where people can go ask, this is the provider I want to go for, can you enable a cashless for me? We are doing that for the customer. Then even from a hospital perspective, till today the empanelment has been purely an offline process. Send it through emails or meeting somebody else. We have come up with a pure digital process where any hospital can come on a digital channel, apply for an empanelment, and basically gets approved within minutes. It's not a laborious process of fixing the pricing and verifying and all. It just works on a technology. Then we are also, from an insurance perspective, like to build an experience, we are built a selected network of a hospital where we are guaranteeing an experience, we are guaranteeing a financial outcome for a patient if they decide to go in such a hospital, which we're calling as a select network. So from an insurance perspective, I think it's not about challenges, it's more about how as an ecosystem we can work together, execute, and focus on our member experience, make sure that they get what they are expected to. The lot of problem in healthcare is basically the uncertainty in terms of there is a lot of unknowns. At a time of admission, at a time of discharge, the outcomes does not match for a patient. That's where the biggest dissonance happens. So that's what we are able to solve, and that's what we have done. And in terms of how it benefits consumer, it builds trust, right? We are a trust deficit society, right? I would not like to mince my words here, but
not society, I think you can say about our sector, but it's not society.
So how we build that trust into the entire ecosystem, whether it's insurance, whether it's healthcare provider. Look, nobody is individual here. Insurance is nothing without hospitals. Hospitals, we need providers to provide a good healthcare to our members to make sure that they get the quality treatment. Eventually, what really requires is a quality treatment, as Dr. Datta said, how AI can help physicians, right? That's beneficial to insurance as well. Eventually, their members get the right experience, and eventually that's how the ecosystem gets developed. So I think that's how technology is moving. I think that's how ecosystem moving. Everybody has understood the way forward, how we need to move, and we are working beyond in terms of, rather than just focusing on integrating one HIS, building a bigger layer of technology which can work as an ecosystem right from discovery to affordability to accessibility to predictability.
Great. One more question to you. I asked this question to Satish also in last panel discussion. We all know that future is home care. Everything, preventive, palliative, primary, secondary, they all has to be provided to home care within next few years only. Patient will come for hospital only for emergency services either, or for the elective surgeries, or for quaternary care, or for tests those cannot be done at the home care level. In most of the tests could be done at the home level only. How you see how insurance will transform to cover all these services under insurance what is the future? How are you ready? Are you ready for this, or what is your thought process on this?
So I think insurance has already taken up a challenge. If you see during the COVID time, most of the home care has been enabled by insurance. They understand the way market is being moving. Eventually, the goal of insurance is to provide a good quality healthcare and experience to their members, right? And basically, are we ready for this? If I quote numbers, we have already processed 6 million healthcare transaction in the OPD space as MediAssist. Now, whether that's a home care, whether that's a physical visit, whether it's a teleconsult, immaterial for us. So we have already done that. We are ready to basically to take that up. And there are a lot of insurance product, if you see in the market, already covers home care. Standard retail plans already cover health checkups, right? Now it's just about the mode of how you access them, whether at home, whether at the clinic. That shape is changing. If you see any physiotherapy, you do it at home or in a post-hospitalization scenario, you do it at home, you do it at hospital, insurance are paying for it, right? And every insurance policy covers the pre and post-hospitalization expenses. So it's lack of understanding of the insurance. Insurance might not be paying for this, but insurance does pay for this. And industry is definitely ready. I can confidently speak about MediAssist. Yes, we have been innovating on this. So the number I'm quoting, we did that back in 2015. So that OPD space is already there, and I think innovations will happen in insurance space in terms of distribution, in terms of how the product is created. As I said earlier as well, right? How we all come together, use that data to help other players in the ecosystem to create innovative products. If we keep working in silos, we might not be able to drive that innovation.
Great, thank you so much. My next question is to Dr. Elets. What is the current status of online innovation, online transformation, digital transformation in Indian healthcare industry, and how much time it will take, or what is your view in next few years, 5 years, where we will?
So thank you, sir. I think if you if you look at the environment from the government point of view, if you look at from a provider point of view, when we are insurance or a hospital, and if you look at from a consumer point of view. So I think India took a very big step in Digital India in 2015. So digital infrastructure, if we talk about broadband highways, probably digital empowerment, and governance also. So the Disha Act is still not passed. So the Digital Security Act is still not passed, but I think that will be a landmark moment. So I think those are the three pillars that we started with in 2015. And we are in now 22. So where do we stand in 22? So in 2019, again, a landmark jam Trinity. So it was not ever thought to be of use for vaccination, but the Jan Dhan, Aadhaar and mobile amalgamation was very, very pivotal in doing the COVID vaccination drive, which was probably after America the most successful vaccination drive. If you look at the UPI payment, so 30 billion UPI payments. If you look at in the first time in the budget, this time we talked about M-Health. So I think if you look at it, we are probably ready to take that leap of faith after 7 years. If you look at from the healthcare point of view, I think the only silver lining which came out of the COVID pandemic is, I think mentally, in ecosystem wise and infrastructurally, I think all the providers now are integrating and wanting to go ahead in terms of telehealth, M-Health. I think adoption probably of telehealth was probably from the doctor's point of view, because I think I'm a doctor and I can say very well, probably they're the most difficult people for adoption of technology, because we don't want to change our workflows. So 80% adoption of telehealth in northern part of India to about 40-50% in southern part of India. So we are ready for adoption. I think if you look at it from the next 5 years point of view, so I think will be a huge trajectory this is going to be. So I think right now digital healthcare probably valuation is around 250 billion. I'm very sure in next 5 years, in 2027, it'll probably about $1 trillion mark. And I think why do we say that? Because I think the digital infrastructure is ready, empowerment, all the right noises are being made, Ayushman Bharat digital mission, the government infrastructure is aligning towards that. I think everybody is now integrating and contributing. And a lot of mobile health. You see, we talk about there's a buzzword called the next half billion. So in the last 4 years, about 500 more million people accessed mobile internet. So in the last 4 years, and 60% of M-Health or 40% of M-Health is going to be the market driver for this in the next 5 years. So I think all these factors, the next half billion, the integration of mobile health into all this, and I think the way we have accelerated during the COVID probably will be a landmark in the next 5 years, how we are accessing health through online healthcare ecosystem.
Thank you so much. If we talk about the online ecosystem, online innovations, online transformation, digital transformation, definitely the consumers are willing for it. They are ready, they are willing, there is a huge demand. Around 70% of our population is residing in the rural areas. However, there is a paradox. 70% of the hospital, paramedical staff, nurses, doctors, they are confined to tier 1 and tier 2 cities. Digital transformation, online transformation can be one of the major players in transforming the life of these people who are residing in remote areas. And that is the need of our. It will provide accessibility to the remotest person. And the government is willing, government is ready. We have seen it that for the COVID app, there are so many vaccines. There is one of the best app available in the globe who is provided billions of doses to our Indian citizens. There is a NHA, National Health Authority. They have started Ayushman scheme, PMJY, and that is doing great thing. And their processing time is quite less. They are processing their claims within hours. And we talk about the private players. Healthcare system is ready, hospitals are ready, doctors are ready, paramedical staffs are ready. They are all having great experience with their innovative systems, online systems, HIS, but there are few challenges. I think they will be sorted out soon. If we talk about the insurance players, they are ready, they are definitely doing great job. They have done great job during COVID pandemic. They have reduced their turnaround time in different stages of billing, processing or claim settlement, providing the reimbursement. I think we all are ready. Thank you so much for all of you for coming on this dais, and thank you Elets for providing this platform. Thank you so much.
Thank you. Thank you so much to all these esteemed panelists for giving very, an engaging and insightful discussion on transformation and innovation driving the online healthcare ecosystem and reshaping the health infrastructure. May I request my colleague, Mr. Sunil Kumar, to please step up on the stage and felicitate our panelists over here. May I request the team to please bring up the mementos on stage. We'd like to extend our gratitude to Dr. D.K. Gupta, Chairman, Elets Hospital, for moderating this discussion. A round of applause, please. Thank you so much. So please, Mr. Varun Kansal, Medi Assist Healthcare Services Limited. Thank you so much. Dr. Shailesh Jhaver, Director, Apex Hospitals Critical Care Hope. Thank you so much, sir, for being here with us. And Dr. Raja Datta, Director, Avisa Smart Hospital. Thank you so much, sir, for being here with us. Thank you. May I request for a group photograph with the magazine, eHealth? Thank you. Thank you so much to all the esteemed panelists. We will now head into the industry presentation on paradigm shift in digital radiography by Mr. Manjunath Arumugam, Application Manager, India, Aqua Healthcare. Mr. Manjunath, kindly step on stage, please. Thank you so much.
Good afternoon and all. I'm happy to be part of this summit. I'd like to give a small introduction about the company and the products we offer. We'll start with the CRs. Here it is there.
No, it's not on.
Sorry for the disturbance. So at first, the company having more than 150 years of experience in imaging industry, and we also offering several products ranging from different categories. We'll start with the CR modalities. Based on the customer need and the volume, it will be starting from small 10x to the maximum DXM range. The advantage in CR, what could we make different will be the needle pulse per imaging technology, which is similar to a DR technology that also we offer, and successfully the customers are much happy about the image quality with the needle pulse per cassettes as well as the ACFAS image quality. So based on the need and volume, you can choose your product. When it is coming to the printing solution, whether it is a normal X-ray, ultrasound or CT and MRI, there will be a different, either depend on your space restriction Either you can go for the tabletop one. If you want to do a high resolution printing, then you can go for the Dry-Star Axis, which is a highest DPI printer available with ECFA. So you can more confidently print your CT and MRI films with ECFA. Not only that, we are also having a big portfolio in DR, where we start with retrofit DRs, which we recently launched the XD panel range, the Dural line, which is more durable and maximum output, highest in the industry now with up to 16 hours of battery backup with the retrofit panels, as well as we have a wired MAM of retrofit panels. Then we have a floor mounted DRs, ceiling suspended models and the mobile DR. Based on your needs and your room restriction and the case volumes, we can offer this. When we speak about the things about the image quality and other thing, we definitely have to mention about the Musica, which is our patent software, multi-scale image contrast amplification, which is the best in the industry, we could say. It will divide the images into 12 different slices, segregate, analyze, and finally give the proper output, where you will have a diagnostic confident. Definitely, every time there is a image processed in the Musica software, you will have a confident about the diagnostic quality. And there is no different set of team will be having different image quality. Whoever operate the machine with a one-click workflow, there will be a much easier image quality will be provided with the Musica images. And when coming to the dose mainly, as per the Frost and Sullivan reports, ECFA images are up to 60% dose reduction compared to anything in the industry available. So when we talking about the patient dose, it's always a question mark. There is no confident about how much dose we are giving, how much repeat cases they are doing. So where with ECFA, you can reduce, and there will be absolutely 99% there will be no repeats necessary with the images. And this Musica software is not only with the premium DRs, it's also available with the basic CRs also. Either they are going with the CR or DR, it will be the same software which is provide the best possible quality available. When we are coming and talking about the AI and the artificial intelligence in the radiology field, we already implemented this with our DRs, with the DR600 and DR800, where we have implemented a different type of AIs. The first one to start with in the Smart XR segment, it will be a smart dose, where the system will have a three-dimensional camera which will capture the patient details and it will analyze so how much the patient thickness was. And it will suggest to the radiographer how much dose he has to select. We also having a AEC, so which will decide how much dose given to the patient, but with help of this smart dose, it will further reduce the dose to the patient and easy the work of the radiology team. So with this maximum, we can get the output from the any machine with fewer retake, because it's automatically deciding based on the patient thickness. So we no need to, in the olden days, they used to calculate literally how much MAs we had to give. Sometime in the very old conventional method, they used to literally take a scale and measure the patient thickness, then decide how much kV and MAs to be added, which will the machine will do now. So they absolutely go freely without any much worry about the patient thickness. They confidently go for the images. Again, it is a patient-tailored dose. There will be no patient-tailored dose available with normal machines. Like if it is a normal patient, give this much. If it is a fat patient, only give this much. It is not like that. Each and every patient have a different body thickness, even though outside it looks same. So with help of this infrared rays available with smart dose option, every patient will have an exact dose required, not extra, not a low. In Smart XR, the second segment will be the Smart Rotate option. Like most of the time in the olden days, we used to have a manual dose in the cars. Now almost everybody having an automatic, just push the button and having the doors windows closed because of the advantage. When we see in the Smart Rotate, it might be look very small. It will automatically rotate the images without a manual intervention. So the radiographer no need to